New Zealand में जो हमारी जमात है, it has done quite a bit of work, especially in organizing blood donations. On occasions there has been a shortage of blood in the hospitals, and our Khudam have been very good at organizing it, getting the Ansar as well as the Khadims to help with the blood donation process, and also making themselves available if ever it was required, that if there's a further need that we are always available over here. And this has been going on for the past several years or so, and the relationship between us and the medical department is very good. On top of that, the Lajna have been also involved with helping geriatric hospitals, especially feeding the elderly, those men and women who are very old and unable to feed themselves. The Lajna have fed them, and I've also helped on a number of occasions to feed them. And as part of the what you call there's some members who would also visit the elderly people in hospitals whenever they're in hospital, just to say and meet them and share a few words with them, and to make them feel much more comfortable. In recent times, the Ansarullah did a walkathon and raised funds for the Fiji Blind Society, and Alhamdulillah, we raised in fact a record amount, and they did mention that we have not received a check, such a large check, in the past, and it was $4,000 plus, which the Ansarullah actually raised and donated to the Fiji New Zealand Blind Society. Some of our social workers, and basically we have got a Jamaat member, Mrs. Marising, who was involved with quite a bit of social work, and she had contacts with the corrections department, which is very similar to the prisons department. And what had happened was they had approached us for helping them with rehabilitation type of activity to help rehabilitate prisoners. And we made a submission in terms of what kind of material we could put, because this was the first time that Jamaat, the government department, had requested our Jamaat for assistance in helping with rehabilitating prisoners. So we set up a sort of a guideline and a syllabus to help the prisoners to rehabilitate them, because unfortunately the prison system is there to put them in prison but not really prepare themselves for when they leave prison. And that is one of the sort of bigger achievements we've been involved with. And we need prayers for that particular activity. Huzur has given his prayers in that particular regard to help and make these people better citizens in the country.
Jamaat-e Ahmadiyya इंडोनेशिया ये ब्लड डोनेशन के बारे में हम हर 3 माह के बाद डोनेट करते हैं, और ये रेड क्रॉस हमारे पास आते मस्जिद में, और ये सिर्फ एक मस्जिद में ही मुख्तलिफ, क्योंकि हमारे पास इंडोनेशिया में वो तकरीबन 300 मसाजिद हैं, तो कम से कम हाफ जो तादाद है ना, about 150 मसाजिद में वो हम करते हैं ये ब्लड डोनेशन, और लोगों को बहुत पसंद है। बस ये जो हमारे मुखालिफ तो बस कहते हैं कि ये जो हमारी जो जमात अहमदिया, ये अहमदियों का खून है ना, हलाल, तो हम कहते हैं ठीक है हलाल, क्योंकि हम तो हर 3 माह के बाद वो ब्लड डोनेशन देते हैं, तो इसलिए भी इस तरह भी कॉर्निया डोनेशन इंडोनेशिया में सबसे बल्कि ये अकेली जमात है मुसलमान में से जो कॉर्निया डोनेशन देती है।
अल्लाह ताला के फ़ज़ल से नाइजर में जमात अहमदिया की बाकायदा रजिस्ट्रेशन सन 2000 में हुई, और इस वक्त अल्लाह ताला के फ़ज़ल से 25 जमातें कायम हो चुकी हैं, और अल्लाह ताला के फ़ज़ल से जमात को 11 मसाजिद की तामीर की तौफीक मिली है।
The first thing we can recollect now is the blood donation. This has been regular for more than 20-25 years, and even a small Jamaat, we are one of the best donors. We are recognized by the Mauritian Blood Bank as one of the best donors. Sometimes where there are mega donation, bringing companies together, they receive 200 or 250. But in 1 hour donation organized by Khudamul Ahmadiyya, we go over 200. This is also growing. And in Madagascar, we do a lot of charitable works and humanitarian work, because they are very poor countries. Regularly. I'm not talking of regular visits to the homes. and to the people old age where they are staying, to the mental hospital, giving cakes, giving foods and clothes and all that. All these forms part of our activities, yearly activities, and this is recognized by the press, by the authorities, by the government, everyone. The municipality do know that if they have to do something quick and if they want to get manpower, big manpower, they can easily count on Jamaat Ahmadiyya Mauritius.
बिला इम्तियाज रंगो नस्ल और मजहब व मसलक, जमात अहमदिया जब जहां और जैसे भी इंसानियत की खिदमत का मौका पाए तो उसे अपनी गुमशुदा मीरास समझकर इस मौके से भरपूर फायदा उठाते हुए इंसानियत को भरपूर फायदा पहुंचाती है.
During the tsunami, when the Southeast Asia hit by tsunami a few years back, we also Humanity First take part to give help to the people who affected by the tsunami. We give some food to them, some money, and then all clothes to the people.
और सुनामी तो इंडोनेशिया में सिर्फ एक जगह नहीं, वो जो यानी कहते हैं मुतासर इलाका, यानी सबसे मुतासर इलाका तो अचे. वहाँ भी हम काफ़ी महीनों तक काम किया. ना सिर्फ ये क्या खाना खिलाना या कपड़े देना, बल्कि जो वाटर सिस्टम, ये हम जमात ने ह्यूमैनिटी फर्स्ट के ज़रिया से हमने वहाँ काफ़ी पानी का जो बंदोबस्त किया लोगों के लिए, और स्कूल्स का जो यानी ये सामान हमने भी मुहैया किया वहाँ.
Government appreciate what we have done. The Humanity First in Malaysia give help to the people who hit by the tsunami. And part of it also during the flood, we also give help to people who were affected by the flood, and they are very appreciated, especially the people there, and they like what we done. And also we mentioned about Humanity First to them. We are from Humanity First.
During the Fiji floods, the Humanity First International, together with Humanity First New Zealand, helped with medical type support, working with the Ministry of Health in Fiji in close liaison. So we had a number of people on standby if it was required to provide that service. And this was more in terms of public health type support, where if at all there are things like a dengue fever or dysentery or typhoid or those kind of illnesses arose, then we had a backup system in place to help them. And by the grace of Allah, it didn't really get to that level because of due precautions taken by the medical department. And just to let you also know, through Humanity First International and the manual that they have produced, the manual was given to the Minister for Health, and he was very grateful for that resource in terms of disaster relief work. In terms of providing relief work, the Fiji floods was one very good example. The other one was the Banda Aceh earthquake as well, that Humanity First New Zealand organised and raised funds for that. But as far as Fiji was concerned, the Humanity First New Zealand coordinated the entire activity of support by using resources available in Fiji. And by the grace of Allah, Fiji being a much smaller organisation, the resources that they had was limited. So from financial resources from the UK, from the US, and from Canada came through New Zealand, and to help. We had set up a system which is basically through previous knowledge of working in Fiji, using the district officer as a guide in terms of where it was most needed. Whereas some other charity organizations just went and helped ad hoc, we went through a system, and the district officer allocated a district councillor to provide assistance and guidance of where food was needed. And what happened was those people who had missed out, and these are people in much more remote places, they were able to get food. And some people had missed out on food and drink for 3 or 4 days, and were relying on coconut water and coconut meal for their meals. So What we also did was did a rough survey in liaison with the district councillor of what was required, whether they required medical help or whether they required normal basic commodities. So we set up a special parcel based on their needs to provide it to them so that they had food. On top of that, what we also did was, because the floods actually damaged houses to the extent that exercise books and textbooks and other resources which the children used in schools were unfortunately damaged. So they were also provided funds and material for that. And because the floods, obviously, it's the river that floods over, most of the alluvial soil and alluvial land is next to the river, and the floods had damaged all the crops, so they had no source of income. So the Jamaat, the Humanitarian First New Zealand, working through our coordinator, Tahir Munshi Saab, was the Naib Amir in Fiji, was the chief coordinator.